Good afternoon, everyone. My name is Kim Stevenson, and I'm Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Patient Partnership in Action, BMC's Patient and Family Advisory Council Model. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2025 annual sponsors and strategic partners for their support in underwriting today's webinar. This is just one of many events we offer throughout the year to connect our members with leading experts to help address timely issues like the one today. I'm very pleased to introduce our speakers from Boston Medical Center's Patient and Family Advisory Council today. Nicole Aguirre serves as the Director of Patient Experience at Boston Medical Center. She brings extensive experience in patient advocacy and healthcare operations from prior leadership roles at Mass General Brigham, Charter Care Health Partners, and the March of Dimes. Sabra Barquez is a former nurse and case manager at Boston Medical Center for 40 years, retired to care for her mother, and later joined the Patient and Family Advisory Council. She brings her experience as both a dedicated caregiver and a longtime BMC clinician to advocate for dementia-friendly and compassionate care. India Smith is a former dialysis and apheresis nurse at Boston Medical Center who joined the Patient and Family Advisory Council at its founding and continues to serve as a dedicated member following her retirement in 2020. Keisha Wilkinson is a member of the Consumer Advisory Board at Boston Healthcare for the Homeless program and the Boston Medical Center PFAC, and is a dedicated advocate for individuals experiencing homelessness, contributing to initiatives in housing, HIV care, and patient education. Thank you so much for being here today as we look forward to this discussion. And now I will hand it over to Nicole to get us started.
Great. Thanks so much, Kim and Amy and all of MHA for having us. And thanks to all of you joining us today. I know your schedules are busy and we appreciate you spending some time with us at the lunch hour. We are grateful for the opportunity to share integrating meaningful patient engagement in quality, patient safety, and experience on behalf of our Patient Family Advisory Council and Patient Experience team at Boston Medical Center. All right. And so we hope that in the next 45 minutes or so, you learn about integrating the patient voice in committees, events, and partnerships. I'm going to start us off today with an introduction to patient experience at Boston Medical Center and ground us with a little bit of general information about our Patient and Family Advisory Council, which you'll hear me say PFAC a lot, as well as the new Patient Safety Structural Measure, PSSM. A lot of things and words today. Then we'll spend most of our time hearing from our esteemed PFAC members, and they'll indulge me in answering some questions about PFAC and BMC. We're going to be sure to review some concrete examples for you guys, including challenges and opportunities specific to the work that we do to impact patient safety. And I think we're going to go to the next slide here. Amy, can you go to the next slide for us? Great, thanks. So at Boston Medical Center Health System, our roots date back to 1855. We've come a long way and we've expanded our services to better support our community. Most recently in 2024, when we added Good Sam and St. Elizabeth's, who are now BMC South and Brighton respectively. But today we're here to talk about Boston Medical Center, our largest safety net in the Northeast. And our mission is to provide exceptional care for all. And on the next slide, Kim, could you go to the next slide for us? Or Amy? Or not? Sorry about the slide issues, folks. Oh, I think I'm seeing something different than everyone else, and I certainly apologize for that. We should be back at
Nicole, do you want to see if you can share your screen again?
Yeah,
Sorry about this.
Yeah, sorry guys. I was sharing my screen and then my screen wasn't being shared anymore. So we have a little issue, but listen, we're going to get through it because that's what we do.
Exactly.
in patient engagement. So, let me see here. Sorry about this, guys. The one thing I didn't think would be an issue would be tech, to be very, very honest.
Ah,
All right.
okay, it's coming.
All right, here we go. All right, so I talked about this, right? I said how we were going to frame today. You heard me talk a little bit about Boston Medical Center, and then I was at this slide. So everyone can see this vision and our impact, patient experience impact.
Yes, yes, looks perfect. Thank you.
All right, we're back on track, guys. All right, so we talked about BMC Health System. At BMC, our hope, our vision is that every patient is confident in the care we provide and that our staff takes pride in being a part of a dedicated, compassionate team. For us, we really know that we can't focus on our patients if we're not considering our team members and the community that we serve in. And then the graphic on the right reminds us that patient safety isn't its own little thing in a corner. It impacts really important outcomes, clinical outcomes. Our better clinical outcomes are associated with better patient experience. Better patient experience is associated with less patient safety events. And better patient experience is associated with better well-being and resilience of our clinician teams. And patients are more likely to follow their care plans and be engaged in their care when there's a better patient experience. So it's bigger. It also impacts our reputation in the community, our awards and recognition, and financial strength through our pay for performance programs. Okay. Now, our patient experience team at Boston Medical Center. So, informed by the patient voice, our mission is to influence the culture and guide improvement to enhance experience at BMC. Not all patient experience departments look the same, but this is ours. And our department really uses the patient voice at the center. And we organize our work into four main buckets. The first is measurement, the second is operations, and the third is education and improvement. The fourth is the one that we're going to spend the most time talking about today, and that one's engagement. So, patient engagement can take many forms. It can be overwhelming. It's so much so that it can be hard to wrap our arms around. At BMC, we approach engagement with clear goals, adhering to key values, including respect and co-learning. And it takes time and resources, and it's important for all of us doing this important work that we understand potential challenges and risks. And we do it because there's so many benefits to engaging patients, including enhancing quality, increasing equity, and bringing diverse and sometimes seldom heard groups together. That list in the third column shows us some of the ways that we can engage patients and loved ones: partnerships, committees, working sessions, events, interviews, surveys. But for today, we are going to talk specifically about our advisory council. Here we are. So this is a photograph that we took at our summer get-together that the PFAC organized. And so our main hospital-wide advisory council has been enhancing partnerships with patients, families, caregivers, and staff since 2010. We have 15 members, mostly patients and loved ones. We recently implemented a co-chair structure. And I just want to take a moment to give a shout out to Sophie, who's there in the middle. She has been supporting the Patient and Family Advisory Council for over 4 years. Right now, she's on maternity leave, as you can likely see from that photo. That was a few months ago now. But she's been invaluable to this work, and she would be presenting if she was available today, and we look forward to her return. So another quick note, today we're focused on this hospital-wide PFAC, but we do have a few other advisory groups at BMC, including the Perinatal Advisory Board, Immigrant and Refugee Health PFAC, and our Public Health Patient Advisory Council. Digging in a little bit more to some specifics of our council, in a typical month, we have 2 meetings. Patients and families receive a stipend of $30 per meeting. Outside of the meetings, we're planning, following up, connecting with guests, fact-finding. And to the right here is an example of our annual report. When we send out the slides, that link will be live so you can click and take a peek for yourself. And our reports usually have projects we've partnered on, things we've given feedback on, member stories, recruitment strategies, goals and achievements, and events. Okay, so I'm going to switch gears a little bit now and talk about the patient safety structural measure. And so because we're here today to connect our engagement work to this newly established measure. And the purpose of the measure is to drive action and improvement around patient safety. And we should quickly note what patient safety is. And simply put, for the purposes of today, it is about preventing harm to patients. We don't need to be experts on the structural measure. We just need to know a few quick things so that we can connect our engagement work to how it is, how we support that measure. So the measure has 5 domains. And then each of the hospitals now required by CMS has to attest that to these 5 domains on how much they are in compliance or how much they meet some of the statements of the domains. So leadership commitment, strategic planning, culture of safety, and accountability are the first 4. And we really care about this last one, patient and family engagement. And it's included because the government and all of our quality organizations and safety organizations really recognize that patients and their families are a critical aspect of patient safety. So there's those 5 domains. And then within the domains, there are statements. So in the one, forget about all of the other 1 through 4 domains. Let's just think about our patient safety structural measure, domain 5, around patient and family engagement. These are the 4 statements that we're going to talk about today. You don't need to read all of them in detail. We're gonna get into it a little bit more. So in the next portion of our talk today, we're going to go through each of the 5 statements, which you can see here on the left, and we're going to talk about a specific action at Boston Medical Center that meets that standard or that supports that particular statement within the standard. So at this point, without further ado, I'm very excited to welcome back or welcome to the screen, Sebra, India, and Keisha. Let's see you guys get on camera so that we can do our discussion, really fun, interactive chat with our PFAC members around these measures. India, I don't see you yet. Are you on camera with us? All right, we'll get started and hope that here you are and off mute. Okay, cool. All right, I'd love to start off with learning a little bit more about you guys. And Sebra, we're going to start with you. And what I'd like each of you guys to think about is, when did you join PFAC? What drew you to the committee? Or what's the best part about being a member? Sebra.
So I joined the PFAC in November of 2021. And the reason that I joined the PFAC was because of my experience with my mom when she was hospitalized the last week of her life, July 7th through July 16th of 2021. My interaction with some of the staff from the emergency room to the floor made me feel dismissed, diminished, and not valued as her 24/7 caregiver, especially, since this was during the pandemic. And after she passed away, I needed to find my voice to speak about my experience that would hopefully be shared with the hospital in some way, and maybe have those that interact with patients see that the patient is a whole person that needs to be cared for and not just the task that was performed during care. And most importantly, that the family or the designated person is an important member of the care team. And so being on the PFAC, what I think is the best part about being a member is that I've really had an opportunity to see the hospital and how it recognizes that being a member of the care team is very important. And it's continuing to put measures in place that I, as a PFAC member, have contributed to.
All right, love that. Thanks for sharing. Keisha, can we go to you?
Hi everyone. I joined PFAC in 2022. I have lived experience with homelessness and substance use disorder. And I wanted to be a part of the change to address the way patients who are homeless or have substance use disorders or both are treated in healthcare, especially with an emphasis on the homeless patients.
Thanks, Keisha. We're lucky to have you. And India, tell us about your experience on PFAC.
Well, I came to Boston Medical Center in 2002 as a dialysis nurse, and then in 2008, the hospital trained me to perform apheresis, which is the technology that can be used to collect stem cells from the patient's bloodstream for a stem cell transplant. And I specialized in that until I retired in 2020. Both dialysis and apheresis are long procedures, 4 and 5 hours, and that gave me a lot of time with patients and families. And I came to see that the patient experience was somehow connected to the clinical outcome. And in fact, safety issues were often part of that, either directly or indirectly. And the knowledge was sort of a burden. I wanted to share it or do something with it in some way because I thought it could be used to improve care. So when the BMC was going to form a PFAC, and that was in 2010, I applied immediately.
Awesome. And your institution, your knowledge is super
I'm
helpful.
still here. Yeah.
We're glad you're here. Okay, so to our first statement of that PSSM domain 5, it says our hospital has a patient and family advisory council that ensures patient, family, caregiver, and community input into safety related activities. And we have something called a guest meeting at our BMC PFAC. And Sebra, I'm hoping you can tell us a little bit about how did that guest meeting evolve? What is a guest meeting?
Well, first of all, the PFAC meets twice a month. And when I joined the PFAC, we were actually just meeting once a month on the third Thursday of the month for 90 minutes. And the agenda was always full. We always had our committee business. And then we had our presenters, the guest presenters. And we found that because we were consistently running out of time, we didn't really have an opportunity to have a good Q&A and get, robust information. So we decided to have another day that we meet, which is the first Thursday of the month for our guests, and that's 60 minutes. We also found that the hospital community was reaching out to Sophie Wilson, who is the patient insight manager who you talked about that now is on maternity leave. But they wanted to they were requesting to come to the PFAC. And the guests shared information and provided a lot of general education for the PFAC. But they really wanted to present to us because they wanted the PFAC's perspective and our guidance from the patient and the family lens.
I love that. And I love that that PFAC decided we need more time, we need more meetings so that we can interact more with some of these folks who want to come talk to us. So, Sabra, can you connect how having this extra space for guests connects to that patient safety structural measure?
Yeah. So, like I said, it was the hospital community that was kind of knocking on our door. And the presenters represented a lot of areas from the hospital community, including department heads, frontline managers, other committees and departments such as quality and patient safety, health equity, and the perinatal advisory board, just to name a few. And most of the presentations actually touched on safety related activities that included goal setting and metrics. And we also gave input on one of the hospital safety improvement initiatives, which was the metal detectors in the ED.
Good. Awesome. Okay. Keisha, you've been at all of these meetings. What are some of the guest topics that were particularly interesting or that you enjoyed?
We've had them bring the hand hygiene campaign to us. Safety screening launched for the ambulatory. They're considering also putting in metal detector. And we've had patient safety leadership with data and goals from Carrie Guggens. And we also had a gentleman come and speak to us about BMC engagement with Shattuck about consistency of care around substance use disorder, and having Shattuck turned into what I like to call a one-stop shop, where you go from a detox to a 30-day program and so on and so forth. And your records aren't lost and you're safely there. And it's a huge safety risk when you're transporting someone from a detox to a program. So if you could just keep them in one spot, but in different areas, I think your safety issues would be addressed.
Love that. And India, what about you? What are some of the guests that you enjoyed?
Well, we recently heard a presentation from the Immigrant and Refugee Health Center, and a physician on the ethics committee has been working on the policy for withholding and withdrawing life-sustaining treatment. She's updating the policy, and she came to the PFAC to get feedback. She presented a hypothetical case to sort of give a feeling for what this would be, and she wanted feedback on a section involving where there's conflict between families and providers. We also get to see patient experience data. BMC has a bunch of different surveys, and it's very interesting to see our measures go up. If a unit has a creative solution for addressing some issue, it's you can really see it in the numbers. And most of these things do involve safety. Like if the speed to answer the call light, that involves falls.
Yeah, totally. Thanks, India. Okay, Sebra, it's been about a year since you all put this guest structure in place. How's it going? Any changes coming?
Well, I think it's been pretty successful. And I think it's been successful because when we conduct our business meeting, we had some goals. And one of our central goals that I'm proud to say we've accomplished is creating our co-chairs. That has been really instrumental in just having a committee-led structure. And for example, with our meeting in September, we discussed defining how we prioritize the guests through the year to align with a lot of our goals. We created a clear structure for presentations, which includes how much time the presenters are coming. And also that's important because it allows us as the committee members to share with our questions and answers, and that makes that really equitable. We actually are in the process of discussing creating templates and structures for the co-chairs to actually meet with the guests to help prep. And once again, that's committee led. And we discussed outreach to hospital communication channels for teams to technically apply, to come to present to us. And that markets the value of patient engagement.
I love that. It's really awesome. Okay, so that was our first topic. We're going to transition now to our second topic. And we're going to talk a little bit about the makeup of our PFAC or our census. So the PSSM statement says our hospital's Patient and Family Advisory Council includes patients and caregivers of patients who are representative of the patient population. I've had the pleasure of spending a lot of time with you guys recently, and I can see that you're diverse in so many ways. Could you share examples of diversity in your membership? India, I'm going to go to you for this one.
Well, we pretty much check all the boxes. We have race and ethnicity, socioeconomic status, high and low, immigration status, age, gender. We have a good balance of men and women, and a trans woman was a member for several years. Another thing is we have a range of different care settings and treatment experiences, ambulatory care, different clinics, the ED or inpatient care. And we have a good balance between patients and family members. Plus, family members are often BMC patients. So that expands the kinds of experiences we can bring to the discussion. I think our diversity is really the reason people listen to us. We feel very accepted. We feel on an equal footing with one another. And that enables us to speak out honestly. And that's a reason why we have some credibility, I think.
I love that. That's great. So it's great that you've had this experience. How do you make sure that this stays true and that we continue to evolve with what BMC's census looks like?
Well, I think we're all watching it. Recently, someone noticed we didn't have a member with a disability. And so our coordinator, Sophie, reached out to outside organizations for people with disability and found a BMC patient who was willing to be on the PFAC. In fact, Kristen McCosh, Boston's commissioner for persons with disabilities, she came to the original PFAC meetings, and one of our original members for until 2020 is an activist for people with disabilities. So we try to include every voice.
Great. Tell me a little bit about the recruitment process and how that also supports diversity.
Well, Sophie advertises, I think during Patient Experience Week, that's a big time for advertising the PFAC. And she advertises on the hospital website as well. And we get a lot of applications. And the applicants describe what is the experience that makes them want to be on the PFAC and how they think they could contribute. And the members read all these applications. We rank them in how they could contribute. And we're also keeping in mind how it would impact our diversity. And we discuss, then we rank them again, and we vote, and that's how we get our new members. I just would like to add that most of the applicants describe a negative experience, and they want to be on the PFAC to correct that and make things better. But a number of our applicants say that they had a great experience. They're not coming with a complaint. They want to give back in some way.
I love that. Thank you for that feedback on the second statement. I'm going to transition us, we're a little behind on time, so I'm going to transition us over to the third statement for the patient safety structural measure, which says patients have comprehensive access to and are encouraged to view their own medical records and clinician notes. It says some more things, but we have enough there. So at BMC, we have something called MyChart, which is connected to Epic, which is our electronic medical record. And it's our patient portal. I know you guys all use it. Keisha, I'd like to go to you to tell us some of the features that you personally use or that you've seen that support this statement in the patient safety structural measure.
Thank you. It gives us access to our medical records, a medications list that we're on. We can see our test results, whether it be blood work or maybe a radiology scan. And we're able to communicate through messages with our providers. I use it basically for my pulmonary pharmacist. She's great, and she actually, will get right back to me, and, it works out really good. I can make sure that my meds are renewed, or if there's an issue with being able to get them processed at the pharmacy, and prior authorizations that hardly go through, and it just the back and forth, and she's really great about helping me. So and it also has a section for community resources, as well as there is a part on the app that you can change the language to Spanish. And it actually gives you a help button with videos about using MyChart and the different things that you can utilize it for.
All right, thanks. And Sebra, we have that MyChart, but what are some other resources outside of that app that we can use to access medical records and important information about our care?
Well, technology is changing everything, but people still want to look at a paper record and get paper information. So you have the ability to actually go in person or to, request your paper record. And I think that's really important because that also shows us how BMC still has the highest standards of privacy and security. There's a process you have to go through. You have to fill out a form for the information that you need. And you can also get information updated and amended. Because sometimes when you go on MyChart and you see those notes from your visit, you may say, I'm not sure that that's what I said or I understood. So you can actually have that changed, go into medical records. And I think that, technology is wonderful, but it moves so fast sometimes. So it's really important to be able to keep up with the changes. And looking at our roles as PFAC members, I think it would really be a great opportunity for the hospital to include a patient on the committee, that's working with medical records to hear our voice in terms of changes that need to be made.
Love that. Excellent point. Okay, switching gears to statement number 4. This says incorporates patient and caregiver input about safety events or issues as patient submissions of safety events, safety signals. So number 4 really isn't as much about PFAC as it is about Boston Medical Center's programs or policies and procedures. So for this one, I had to consult my amazing colleague, Cheryl, who's the director of patient advocacy, to get a refresher on something that they do in patient advocacy or at BMC in general, which is they have an emotional harm index that they track when they get patient feedback. And they define emotional harm as an event which undermines a patient's fundamental dignity, causes a patient to seek care elsewhere as a direct result of an event, or led directly or indirectly to clinical harm. So they're thinking about this and using this as they're listening to patient feedback and documenting. And she said that we need to care about them as much as we care for them and our patients. So it's really awesome. We could have a whole talk just on that. But Sebra, I know that Cheryl's come to our PFAC meetings and she's talked about this. And what was your thoughts, reactions, feedback on it?
Well, you know what? She was speaking to me. She was speaking to my situation. And I'm happy to know that the hospital really is putting concrete measures in place for the patients to be heard. Using the direct feedback, from the patient through complaints and grievances to connect it to safety that looks past the physical harm and considers emotional harm is very, very important.
Yeah, I'm proud of the work that we do at BMC, and that's certainly one of them. So kudos to our patient advocacy team. Okay, we're on to number 5, the final statement in domain 5 of the patient safety structural measure. And this talks about presence of family and designated support person. So we're going to spend the next 15-ish minutes, because we're hoping to have some time for questions, on how we include patients in committees at BMC. I was super impressed when I came to BMC and learned about this. So, Keisha, I understand you're a member of the Equity in Healthcare Committee, which is part of BACO, the Boston Accountable Care Organization. Can you just tell us a little bit about that committee, your involvement, and your involvement?
Yeah, we meet once a month, and we have like different community health centers that come together. They're all part of the accountable care organizations, and it's done through WellSense. And we look at Relsoji. We give feedback as to how they can ask questions about Relsoji in a more I guess a meaningful way, instead of like being abrasive about it. And maybe some of the questions that they ask at the front desk of an appointment, you might want to talk about somewhere else. So they give you that option. So we give them feedback on that. We're very much encouraged to speak up if we have questions or we want to answer something, or give them feedback on what they're doing. We also have a pre and post meeting. Pre-meeting gives us the time to find out what we're going to be hearing about the next day at the meeting. And then post-meeting is for questions that we didn't feel comfortable asking during the meeting, because some people might find it stupid or silly. And
Yeah, that's great.
so we kind of get to like debrief and just go, okay, yeah, all right, thanks. And, and so that goes that.
Yeah, no, that sounds like a really important part, right? It can be intimidating to go to these committees with all of these different folks, and we're bringing the patient voice. So having that pre and post meeting sounds like a great way to support patients on
It
committee.
does.
Yeah, love that. Awesome. And we'll have to put in the chat what Real Soji stands for.
Yes.
Okay, now let's talk about the ethics committee. And this really is a great story. So I'd like to hear about membership and the role of a PFAC member. And I think India, you're gonna kick us off with this.
Yeah, it's a really big group, maybe 30 people. There's like 8 or 10 physicians, a bunch of nurses, nurse managers, NPs, there's clinical psychologists. Um, there's people from social work, chaplaincy, patient advocacy, case management, and legal. And this is a teaching hospital, right? So most of these people, from time to time, they have students with them. And the chairman of the ethics committee at BMC Brighton, she also attends. Then within this larger group is a consult team of people that conduct live consults for patients in the hospital. And in 2023, the ethics committee voted to form a permanent or standing subcommittee that meets separately, in addition, on structural racism. And it's to examine how structural racism affects care in the hospital. Right now, Sebra and I both volunteered for that, and we're discussing cultural sensitivity for Haitian patients. So we're really encouraged to participate in every aspect of the committee.
I love that. And every aspect of the committee. So Sabra, can you tell us about every aspect of the committee? Like what's the charter purpose?
Sure. When I talked about Cheryl coming to our PFAC meeting to talk about the ethics committee, she really gave us sort of a basic overview, but I think it's important to actually read from what the charter says. And it says the ethics committee shall provide a forum for discussion and consideration of ethical issues and do the following: develop education programs that foster a culture within the BMC community that continually increases recognition of ethical dilemmas and develops strategies to avoid, modify, and resolve frequent occurring dilemmas. Revise, review, propose, and develop policies related to ethical issues and, as needed, make the recommendations to the CEO of Boston Medical Center and discuss monthly those cases that have prompted requests for consultation and maintain a database that serves as an analytical tool and educational resource.
And that's great. And patients are a part of that very important purpose charter mission.
Mm-hmm.
And Sebra, you're going to tell us a little bit about how you joined and how you were prepared to join this big committee.
Yeah. So once again, Sophie informed the committee that there were opportunities to join the ethics committee. And in February, I think that was February of 2023. So Cheryl Katzenik, who is the director of patient advocacy, like I said, presented a brief overview of the committee and the requirements to join. India and I applied. We were interviewed by the chair and the co-chair of the committee, and we were welcomed as members in July of 2023. As a part of the onboarding process, we were given access to the share drive that contained what I just read, which is the charter, the history of the committee, and articles related to ethical issues and some of the discussions. And we were invited to attend the consults and participate in problem solving. Actually, India and I were also able to provide input to revise the current consult form that they use.
Yeah.
And we now continue to attend the consults, and we have an opportunity to participate in grand rounds on ethical dilemmas, both really that focus on safety concerns.
No, I do.
I love that. And so you guys are out there, you're doing this work, you're a part of the committee. How do you liaison back to the Patient and Family Advisory Council about all this work, India?
Oh, well, the PFAC has on the agenda now, it's a regular agenda item at the business meeting for reports from any members that's on other committees. So, and recently I had a report from the ethics committee because at that meeting, the doctor who was working on the withholding and withdrawing life-sustaining care policy, gave a report on her visit to the PFAC. And she had a lot to say about the information and feedback she received. And so it's really a great thing. So she's going to actually come back to the PFAC with a rough draft based on what she learned from us, probably next month.
Love that. And one of the things we talked about when we talked about engagement, we talked about co-learning, because the committee learns from you guys too, right? So Cheryl, that we've talked about a few times, Katznick, is the co-chair of the committee. So I asked her what it's like to have patient involvement, and she said, quote, "The presence of community members on the BMC Ethics Committee has been invaluable and has enhanced the breadth and depth of our deliberations. There is simply no substitute for incorporating the voice of our patients into high-stake conversations. I love the look on people's faces when a community member introduces herself at one of our ethics consultations. Staff often seem both surprised and impressed. It's a new day at BMC." Like, how cool is that, right?
Oh, yeah.
So I'd love to end this discussion to hear from each of you of how does it feel to be a patient member, a part of this committee doing this really important work that directly impacts our patients in so many ways, including safety. India, you want to go first?
Yeah, I do want to go first. I'm glad that Cheryl told me that, because I wouldn't have thought, but they really want to hear what we have to say. I think it helps that Sebra and I are nurses, because we could follow the discussion a little more, but I'm not sure that's necessary. What they really want to hear is how a patient would react to this, and what an everyday person, their gut feeling and judgment on something.
Sebra?
So, like you said, I am retired from BMC, and my mother did have dementia. She had some other illnesses, but when I think about the importance of being on the care team, some of my nursing roles at BMC were a specific part of the team. When I worked in primary care, and medical specialties, I was one of the continuity nurses. And when I worked in case management, of course, the case managers have their role on the team. And as I said before, my not feeling that I was a part of my mother's care team is what brought me to the PFAC. And so I feel really honored on the ethics committee, because I am not only able to offer my clinical perspective, but to voice my perspective from the patient's lens. And that really has helped my healing process. And it really has contributed to me feeling heard and seen and valued.
Gosh, I love that. Love that. All right, Keisha, take us home. How do you feel about being on these committees?
Very empowered. I am very blessed to be here today to tell you that lived experience means a lot when it comes to rules changed, the way things are seen. And I hope it continues in a new and happy level.
Yeah, we love that too. Awesome. Awesome. Well, thank you guys so much for this discussion. I'm going to share my screen again really briefly. So just to close us out, we want to note that this patient safety structural measure we talked a lot about today, it's a helpful mechanism to celebrate accomplishments and understand our opportunities. But at the end of the day, we have to remember that patient engagement is a journey. We're all in different places. It requires time, change management, and has to reflect our hospital's culture and where it's at. We're happy to take questions in the time that we have left today. We understand you might need to think about it a little bit. So if we don't get to yours, or if you want to ask after the fact, we have our patient experience general inbox up on the screen for you guys to contact us anytime. So thanks so much.
Thank you, Nicole. Wonderful presentation. Thank you, all of you. Keisha and Sebra and India, we really appreciate your time being here today, and for sharing all of your insights and your experiences, and even those that were not so pleasant, that were more challenging, but really great to hear all of the important work that you're doing. One question for you. what's something that you thought might be harder than it actually ended up being as you were getting this work up and running, or even today as it continues? Is there one or two things that that folks might think, gosh, I really can't overcome this challenge, but it actually ended up not being such a big deal?
All of them. Oh, Sarah, you have something? I'd love, yeah, please go ahead.
Actually, as I kind of thinking with the ethics, getting on the ethics committee, once again, being a clinician, being a nurse, I kind of understood that process. But in the beginning, I really didn't really want to offer my sort of opinion or my comments because I'm looking at things through the lens of the patient experience. But as I did offer, my comments, it was still accepted, by the group of clinicians that heard me as a patient. So, I sort of struggled with what hat am I going to wear?
Right.
And that hat, from the patient experience was really accepted, when we talk about some of the cases.
Awesome.
Yeah, I'd second that.
Mhm.
To understand that I'm there as a patient, not as a nurse.
I think for me, um, because I don't have these sophisticated backgrounds like everyone else does. I didn't graduate from college, but I graduated from the school of hard knocks from the
Hello.
streets.
Yeah.
And, I felt very like intimidated because I thought I was different than everyone else, and I'm really not. I have just as much to say and give input on as anyone else, if not maybe more.
Hey,
So,
hey,
Yes.
that is totally true.
I love that.
There's something in the chat, Kim. I don't know if you want me to go to the chat.
Yes.
Jane, hi Jane. She said, what is one piece of advice you'd give for hospitals that are struggling to rejuvenate their PFAC efforts? You want to think about it for a second? I'll start in saying that along the theme of what you guys were all just saying, like it can be scary, right? Are we picking the right PFAC members? Like, how do we pick the right PFAC members? Are they representative? Anytime I have felt worry as a staff member of bringing folks together of like, what is this going to look like? I leave with the feeling I just had a few seconds ago when Keisha was talking, which is it's always more rich. I always learn something, and it always brings a positive flair to whatever it is we're working on. So we got to get past that little like scare what if staff side and be more comfortable letting folks in.
And if you look at the hospital's perspective, obviously there are boxes that have to be checked. And it's important to remember that there are boxes outside of that you have to check. And so even with something like this, this is a CMS, measure that we're sort of looking at, but it's still our experience and it allows the hospital to hear that you've come a long way, you're doing a good job, but there's still a lot of work to do. So, to look at that sort of glass half, what is it, glass half full? There's still a lot more, when you're trying to encourage people, to come and be a part of the team and be a part of making a difference. You have to have people feel like they are making a difference.
Wonderful. Any other final thoughts? Okay. Jane, you all have offered such fantastic example of the value of PFACs. Thank you for your service, dedication, and your witnessing for the audience today. And I agree with that. Really a terrific event. Great information shared. Thank you so much. We really appreciate you all taking the time to be here today. And for our attendees, just so you are aware, we have a couple of important events coming up. Our Women's Conference that's going to be on December 5th and our annual meeting on January 29th. You can scan the QR code at the bottom of the screens to look and see all of our upcoming events. We really appreciate the time today. Thank you all, and we'll see you next time. Take care, everyone.
Bye.
Thank you for having us.